opaque information. Hello and welcome to my channel, and for those of you who are returning, welcome back. Please like, share, and subscribe, and please support our GoFundMe. This article comes from Verywell Health. Here's a list of the most common mental health disorders. Mental illness is defined as changes to an individual's behavior, emotional response, or thinking that leads to distress or problems functioning in social situations, work, or family life. Mental health issues are common, with millions of people affected each year. Experts estimate that 1 in 5 U.S. adults experience mental illness each year. There are many different types of mental illnesses, ranging from anxiety and depressive disorders to obsessive-compulsive disorder, OCD, and post-traumatic stress disorder, PTSD. These mental disorders are diagnosed and treated based on criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, that's DSM-5, issued by the American Psychiatric Association. There is no singular cause of mental illness. Instead, mental illness can usually be attributed to multiple factors, including brain chemistry, developmental experiences, and environmental causes. Here are some factors that have been linked to increased risk of mental illness. Genetics. Mental illness tends to run in families. Research has shown that children of parents with mental illness are at increased risk of developing mental illness. However, genetics alone do not explain all the risk. Added environmental factors can make someone more susceptible. Next, physical environment. The environment in which a person lives also affects mental illness risk. Studies have shown that living in an urban area is a risk factor for mental illness. However, researchers note that urban environments may be a proxy for other underlying risk factors. And social environment. Stressful life events can significantly impact mental health. Stressful life events can vary, but significant personal conflicts, such as within an unhealthy relationship, are one example that has strong associations with anxiety and depression. Types of mental health disorders. Mental health disorders can generally be grouped into categories like anxiety disorders, eating disorders, mood disorders, personality disorders, trauma and stressor-related disorders, and psychotic disorders. Let's start with anxiety disorders. Anxiety is generally characterized by feelings of tension, worrisome thoughts, and physical bodily sensations such as sweating or increased heart rate. People who have an anxiety disorder often deal with recurring intrusive thoughts. Intrusive thoughts are unwanted, automatic thoughts that get stuck in your mind and cause great distress and anxious thinking, which can be extremely difficult to escape. There are some major types of anxiety disorders, such as generalized anxiety disorder, better known as GAD, obsessive-compulsive disorder, also known as OCD, panic disorder, and social anxiety disorder or social phobia. And now let's turn our attention to eating disorders. An eating disorder is characterized by significant and persistent disturbances in eating behaviors and is often associated with unhealthy preoccupations with one's body. These disorders can potentially lead to serious medical consequences. Though it is a mental health condition, it is also a physical one, since severe disturbances in eating patterns impact physical health. For example, severe restriction of calories, as is the case with anorexia nervosa, can cause a decrease in bone mineral density, increasing the risk of fractures. There are several types of eating disorders, such as anorexia nervosa, bulimia nervosa, binge eating disorder, other specified feeding and eating disorder, which is any other eating disorder that causes distress and impairs the ability to function at home or work, avoiding restrictive food intake disorder, pica, and rumination disorder, which is repeatedly regurgitating food, bringing swallowed up food back up to rechew and reswallow it. Moving on to mood disorders. Mood disorders cover a variety of depressive and bipolar disorders. While everyone feels sad or depressed from time to time, a mood disorder is different. Mood disorders are very intense and persistent, and they significantly affect everyday life. The following are the most common types of mood disorders, such as major depressive disorder, which is feeling sad, hopeless, losing interest in one's normal activities along with other physical and mental symptoms that last 2 weeks or longer. Next is persistent depressive disorder, formerly known as dysthymia, chronic depressive symptoms that last 2 years or longer. Bipolar disorder, a condition generally marked by alternating moods or depression and feelings of mania or elevated moods. And finally, substance-induced mood disorder, when alcohol, drugs, or medication causes depression or other mood disorders. And now we have personality disorders. Personality disorders are characterized by long-term maladaptive patterns of thought and behavior that may make it difficult to start or maintain relationships as well as deal with everyday stress in both personal and work life. People with a personality disorder might not realize they have a mental illness. There are many personality disorders, which can be classified into 3 major categories, each with its own set of personality disorders. Cluster A, odd or eccentric behavior, such as schizoid personality disorder, paranoid personality disorder, schizotypal personality disorder. Cluster B, dramatic, emotional, or erratic behavior, such as antisocial personality disorder, borderline personality disorder, narcissistic personality disorder. Cluster C, anxious, fearful behavior, such as avoidant personality disorder, dependent personality disorder, obsessive-compulsive personality disorder. And now in this section, we have trauma and stressor-related disorders. Post-traumatic stress disorders are sometimes differentiated into the following types, though they are not included in the DSM-5. Complex PTSD, delayed expression PTSD, formerly called delayed onset PTSD, dissociative PTSD. And last but not least, psychotic disorders. Psychotic disorders are mental illnesses that can cause abnormal thoughts and perceptions that in turn cause someone to lose touch with reality. Delusions and hallucinations are common. Psychotic disorders can cause great distress and functional challenges in everyday life. Types of psychotic disorders include the following, which are schizophrenia, schizoaffective disorder, schizophrenic-informed disorder, delusional disorder, brief psychotic disorder, substance-induced psychotic disorder, psychotic disorder due to a medical condition. There are many types of mental illnesses, which range in severity and how they impact everyday life. There is no single cause for mental illness, and it is commonly caused by multiple factors, many of which are out of an individual's control. Diagnosis requires a healthcare professional, who can also advise on treatment options. There is much more to this article, and I will link it in the description. Thanks for watching, and have a great day. And please remember to like, share, and subscribe. And please support our GoFundMe.